Hi, this is Ayla Beasley, and I'm doing my discussion post over episode 192 Anxiety Assessment with Dr. Kira Moore of the ABA Inside Track podcast. Her dissertation was over anxiety and autism. The articles included in this podcast are Assessing and Treating Anxiety in Individuals with Autism by Dr. Moore, Fullard, Sweetman, and Ahern, published in Behavior Modification 2021, with a supplemental article case study of behavior assessment and insect phobia by Jones and Freeman, published by JAVA in 1999. So what I learned from this podcast is that you have to identify anxiety. So what is anxiety? The definition that Dr. Moore gave in this podcast was something people have that causes behavior. So it's something that's already inside you and causes you to act or feel a certain way, usually because your environment has you feel that something bad is about to happen. And anxiety is a cluster of responses that could be operant and or respondent behavior. And this can include public and or private behavior. And the cluster of responses changes by increasing or decreasing or a little bit of both because of the certain context in the environment telling you that something bad's going to happen. Also, knowing the difference between anxiety versus fear. Anxiety is when having some type of behavioral change in response to a stimulus that signals something bad happening, and fear is in the presence of the adverse stimulus. So anxiety is scared of something that could possibly happen. In the podcast, they talked about being on an airplane. So is it because of the plane itself? Is it because of feeling claustrophobic? Or is it because you're afraid that the plane may crash or malfunction in some way? There's different aspects to determine what's going on. So the dissertation with the participants being autistic or having autism limits the vocal and verbal ability. So therefore, the measure is hard to determine when it comes to anxiety in those particular participants. So the anxiety research is going to be phobia based for a direct measure. She mentioned 1941 study with Skinner and Estes with the rats and the fixed time schedule and using the levers with the long tone and shock, and then also going to that supplemental article by Jones and Freeman of insect phobia, and that's the closest study with humans compared to the 1941 study with rats by Skinner and Estes. So anxiety becomes problematic when it is affecting the everyday life of a person. So looking at the behavior before and after treatment and how gradually exposing that stimulus to overcome the behavior is effective with reinforcement. The paper by Freeman, Hayes, and Wilson of 1998, conceptual paper of anxiety, Woods and Miltenberger of 1996, talked about nervous habits, 3 conditions they did with, I believe, college students. 1, bored, 2, anxious, and 3, neutral. And the people that were bored manipulated objects, while the people who were anxious tended to manipulate like their hair and their face. So different aspects to those behaviors. Autism versus OCD. There's a lot of confusion or misconception with, just because someone wants to knock on the door 5 times before they leave the room doesn't necessarily mean that they're having anxiety because of it. It could also mean that it just makes them feel comfortable and brings them enjoyment. someone who is on the spectrum with autism, that might just be that routine makes them feel more comfortable. So there's, engaging in repetitive and ritualistic behavior because it feels good doesn't mean that it's anxiety or stress. So the survey on repetitive and realistic behavior from this podcast talked about it took a while just to get to identify the particular participants. It took like a year or so because you have specifics with time and context and everyday struggles, and with their participants being that of nonverbal, they have to go to the case manager, and there's a lot of hearsay when it comes to, you just have to go off of the verbal aspects, and you can't always just do that. There's other ways to measure anxiety, but most of the time they just go off of what's on paper and written down. There needs to be more observation. The two types of presence of anxiety during the baseline: calm stimulus has behavior all over the place, or can use escape and avoidance, or the opposite, conditioned repression, is like the deer in headlights. When they did their study for this dissertation with Dr. Moore, then she also talks about the relaxation response, adverse stimulus, and prompting. And sometimes they would break down the adverse stimulus. So if the student didn't want to go to the nurse's office, one day we'll take a step to the nurse's office, try a relaxation technique, and then you can do avoidance. And then the next day, 2 steps towards the nurse's office, relaxation technique, and then you can do avoidance, and just microdose. And you just have to be consistent and keep at it. So the podcast pretty much stated that we should be looking at more measurable components when it comes to anxiety. Usually the complaints about anxiety are because of the effect that it has, the change of behavior, during the normal day-to-day life. And